we'll be talking about the 12 cranial nerves and their function and their nerve type. Starting with the first nerve of the brain, the olfactory nerve. It's a sensory nerve, and it's associated with smell. The nerves are located within the nasal epithelium and passes through the holes of the cribriform plate to reach the olfactory bulbs, and that gives us the sensation of smell. The next one is optic nerve, which connects to your eyes, and the nerve type is sensory, and it is associated with vision.
Our third nerve is your oculomotor nerve, the eye mover. This nerve is a motor. It contains the superior, medial, and inferior rectus and inferior oblique. It's parasympathetic fibers and controls muscles of the iris and the ciliary muscles for accommodation of the lens for near vision. Our fourth nerve is the trochlear nerve. It controls the superior oblique muscle of the eye. It is called the trochlear because of the tendon of this muscle passes through a pulley-shaped ligament called the trochleus, and trochleus means pulley.
The fifth nerve is the trigeminal nerve. It is known as the greatest sensory nerve of the face. It is the thickest nerve we have in our brain. And tri stands for 3, and geminal means twin. And the nerves branch out into 3 across the cheek, jaw, and forehead. And these are associated with the ophthalmic, maxillary, and mandible. And it's associated with muscles for chewing and touch and pain of the face. The sixth nerve is the abducens nerve. It is associated with eye mover, like the oculomotor nerve. It moves the lateral rectus muscle.
Our seventh nerve is the facial nerve. It is mixed with motor and sensory. The facial nerve is a chief motor nerve of the face. It branches extend to muscles of the facial expression. It's also sends out parasympathetic fibers to the lacrimal and salivary glands. Its 5 major branches controlling facial expression include the temporal, zygomatic, buccal, mandibular, and cervical. The 8th nerve is the vestibular cochlear, which is auditory. It's sensory for hearing and sense of equilibrium. The nerve carries stimuli from the inner ear for perception of hearing and balance.
The next nerve is the 9th nerve of the cranial, and it's a pharyngeal muscle for swallowing and parasympathetic fibers to the parotoid salivary gland. It's a sensory nerve for the taste buds, so it's a mix of sensory and motor. The next nerve is the 10th nerve, which is the vagus nerve. It is associated with both sensory and motor. It's associated with swallowing, speech, and heart, stomach, intestine, bronchi, and velatory input across the body.
Our 11th nerve is the accessory nerve. It's primarily motor, which means it's majority motor. Head movement, swallowing, and proprioception. It runs through with spinal nerves to the sternocleidomastoid and the trapezius muscle, where it is involved in head, neck, and shoulder movement. It also sends fibers to the pharynx for swallowing. And our last and 12th nerve is the hypoglossal nerve. It contains motor nerves to the muscle of the tongue, speech and food manipulation, and to the muscles of swallowing.
These are all the listed 12 cranial nerves and their functions.
No. Oh. So some conditions and disorders that affect the cranial nerves. When cranial nerves experience damage, it doesn't function as it should. This may cause specific movements or sensory issues depending on its underlying function. Several conditions and situations can affect the functioning of your cranial nerves, like head trauma or traumatic brain injury, nervous system or brain conditions such as neuropathy or ALS, which is lateral sclerosis, pressure from nearby blood vessels, tumors or swelling, circulatory issues like microvascular disease and stroke, inflammation for certain infections such as the herpes zoster virus, the virus that causes shingles, and autoimmune conditions, accidental damage from brain, facial, or dental surgery. Another specific cranial nerve that has a motor movement where there's an issue, healthcare providers often call this palsy. Palsy means paralysis, which is a result of muscle weakness and movement issues. You can have third nerve palsy, which is oculomotor palsy, fourth nerve palsy, trochlear nerve palsy. This typically causes double vision. Sixth nerve palsy, abducens nerve palsy. This condition typically causes eye misalignment. And Bell's palsy. This condition affects your facial nerve and is a type of facial nerve palsy. It usually causes temporary drooping on one side of the face. We're going to talk about care and how you can keep your cranial nerves healthy. So some cranial nerve conditions are preventable, but you can help keep your brain, cranial nerves, and entire nervous system healthier with these steps. 1, reach and maintain a weight that's healthy for you. 2, eat nutrient-dense foods like fruits, vegetables, and whole grains. 3, get regular physical exercise. 4, keep your blood pressure within a healthy range. 5, manage any conditions that increase your risk of nerve damage like diabetes. 6, drink only in moderation, alcohol. And 7, quit smoking.